Well, hello, everybody, and welcome to the Catholic Marital Intimacy Podcast. I'm Theo McManigal, and this is James Walther. James, how are you today, man?
Doing quite well. Yourself?
Pretty good. We have, we've been doing our YouTube live streams for a while, but we figured it was ready to kind of get a podcast going. I think early on when you started Catholic Intimacy, you kind of thought about doing one, and then we kind of thought about doing one and did an episode when we were almost about to close, and by the grace of God, we've stayed open. And actually, that was several months ago. We've stayed open and going pretty good here for a while. But now we've decided we're ready to really go after it. So, man, what a number of months it's been since then, huh, James?
Yeah, it's been a busy year. Time flies when you're having fun, right?
That's right. And now it sounds like you are getting ready to take some next steps. So you've been coaching. We've been writing our articles. We're going, we're increasing our video content. We're doing this podcast, and then you are getting some further credentials.
Yeah. So, I've been doing the sexual intimacy coaching since January of 2023. We started the predecessor to the Apostolate. Just my wife and I in August of 2022, and started getting requests to work with couples individually towards the end of December there. So I had my first unofficial coaching began there in 2023 and pretty quickly became a regular thing. And because of that, I very quickly realized that while I had a strong theological formation, I didn't have a formation in coaching practice or in therapy. So I took a course in Catholic coaching, which was very good there with Redevive Coaching, Rick Erasmus. But I also started a master's program in marriage and family therapy. So I've been working on that. Had to take a few pauses thanks to the Army. Make me miss a few semesters there, but finally got to the internship phase. So I'm going to be doing that starting in 2 weeks now. So by the time this airs, maybe a week out. So it'll be July 13th, I believe, is the first day I'll be seeing therapy clients. That will be in Washington State, Colorado, and Idaho are the 3 states I'll be able to take clients in. So.
Well, cool. Congratulations on that. And that, I imagine, will be good for you as well as just what you're able to offer and your whole knowledge base. So that gives us a few things then that we want to make sure to cover in our conversation today. First, let's take the sex part out of it. Coaching and therapy. What's the difference? And then we can maybe decide once we bring this sex portion back into it, whether, maybe give some principles for discernment as to whether one wants to or needs to in their particular situation seek one or the other. So let's start out, coaching versus therapy. Similarities, differences, talk about that.
Yeah, so coaching and therapy are both part of the helping professions, right? The biggest sort of obvious difference between the two is, at least here in the United States, regulation, right? So coaching is an unregulated profession. As far as government oversight, to my knowledge, there is no license to be a coach in any state, and yet every state has licensing boards for the various types of therapist. Right, so that's the first thing. Now, within the coaching world, there are coaching organizations, credentialing, certifications, best practices, but there's not the legal oversight that you would see with therapy. So that's the first thing that jumps out at a lot of people is that license element. Then when we get to actually how does it work, there's going to be more overlap. So a lot of the techniques that are used in one will be used in the other. For example, open-ended questions, relational questions, motivational interviewing. And that will also depend on the therapy model that's used or the coaching models that's used. For example, the model that I was trained in, solution-focused brief therapy, is used extensively around the world in both coaching and therapy, because the structure of the and underlying philosophy of the model doesn't need to stay in the coaching or in the therapy realm. Some do. For example, the psychoanalytical model, you really can't do that as a coaching model, because in some of those models, especially we'll say the modern versus postmodern ones, the modern models following the tradition of Freud are what we call medical models. So their primary concern is diagnosis and treatment. That is kind of like if a coach ever diagnoses, they're definitely outside of their ballpark, right? There are things that could be approaching that boundary or crossing into the therapy space where they are effectively treating without necessarily meaning to. That you can have things that have a therapeutic effect from coaching, even though it's not a direct therapeutic intervention. But certainly if somebody is diagnosing and treating, then that is proper to the licensed mental health professions. So that's one of the biggest differences, right, is that diagnosis and treatment. Now, within the coaching and therapy realms, another big issue is insurance and HIPAA. So anytime you're dealing with confidential medical information, right, you are bound to HIPAA as a licensed provider. So as a therapist, you are bound to HIPAA. As a coach, you are not. HIPAA does not cover, you're not what's called a covered entity. Now, all of the coaching boards, the International Coaching Federation, for example, all have principles of confidentiality which are more or less identical to those of therapy, but legally speaking, there's not the same weight of confidentiality as there is in a licensed profession. I think I covered it all, or at least the big things. Anything I missed? Anything?
No, I think that excuse me, that's perfect. Well, now let's bring the intimacy and sexual component back into it. So how is coaching and therapy going to be different in the way you might help somebody, depending on the context, since you are soon about to be doing both?
So let's already step into what's the difference between normal coaching and sex coaching, and then normal therapy and sex therapy, because there are distinct differences. So one of the key principles of coaching is that it's non-directive. Okay, that can also, again, that can be an overlap with therapy depending on the therapeutic model. Like SFPT is non-directive. So you are the coach sits in a role not as a teaching you or telling you what to do to fix your life. They're sitting there in a collaborative role of trying to draw out your own solutions. You know, that's where the art of asking good questions comes in.
This is coaching?
That's coaching. Now, that's also in therapy, that art of asking good questions, depending on the model. Some models are much less concerned with that and more kind of tell you, here's how you fix yourself. There's a very large range. Again, some therapy models like solution-focused brief therapy does that regardless of whether you're in the coaching or therapy realm. But coaching, that is kind of the hallmark of how you do good coaching, is asking those questions, not problem solving or fixing, right? That is not your role as a coach. You're not giving advice. Generally speaking, those principles will also apply in therapy, but there are times when it may become more directive. Again, you're dealing with mental health. You may have to tell your client something that they need to do. It depends. Again, it depends on the model and the structure that you're using. But with that, right, somebody might show up to me for sexual intimacy coaching. I can ask them open-ended and relational questions all day long, and if it is a matter of biology that they've never covered, they're not going to figure out the answer. Most of the people that come to me have very little training. Most people in general have very little training in human anatomy and physiology, very little training in sexual ethics, in sexual technique, and in processes of growth and healing in sexual concerns. So, unlike normal coaching, sex coaching is going to have a slightly more directive or teaching tone to it. Ideally, it should still have a lot of open-endedness, and that's where SFBT is still quite useful in my opinion, because it allows you to hold both things as true, that I am the expert in my field, you are the expert in your life. And that is the mentality I bring to coaching and to therapy of, I know my stuff really well. I've spent the last 15 years studying my fields. But I have no idea about your life. That is your marriage, your lived experience. Right? So still in a collaborative sense, but there's going to be an element where I'm going to teach and then give advice, which I would not do in normal coaching. And that comes to the implicit method. So this is the model or structure, if you will, that is used in both sex therapy and sex coaching. Oh, let me actually take a step back and go to since I just said the distinction between normal coaching and sex coaching, let's go between therapy and sex therapy. In sex therapy, again, you're going to see a little bit more directive role than most therapy models because people may need to be taught. But again, there is going to be a heavier emphasis on identifying, even if it's not formally diagnosed, sexual dysfunction. Okay? So while in coaching we might talk about erectile difficulties, right? Even if you don't meet the clinical definition of erectile dysfunction, disorder, right? In therapy, we're going to lean more towards those precise clinical definitions, generally speaking. Okay, so there is a little bit more of a medical tone to it than there might be on the coaching side. Is that making sense so far?
Yes.
Okay. Now to what's common between them. So both sex coaching and sex therapy, generally speaking, are going to use, now, I say generally, best practice in all the trainings and groups and associations that I'm a member of, the kind of gold standard of sex therapy and sex coaching is what's called the implicit model. So the implicit model, it's the acronym stands for permission, limited information, specific suggestions, and intensive therapy. Okay, and that is the sequence of growth or progression, if you will, of intensity in getting somewhere they need to go. Permission. So in secular versions, you'll typically hear it more like giving yourself permission to do whatever, to experience pleasure, for example. In my work, because I'm working with Catholics, a lot of times that permission element starts with explaining what does the church teach, because people may not be allowing themselves to do things that they could because they don't think the church allows it. So that first layer with Catholic couples is oftentimes showing the church gives them permission to do this, that, or the other thing. And sometimes it is about giving yourself permission. Sometimes men, but mostly a lot of my female clients struggle with that, giving themselves permission to enjoy this. Couples who struggle with scrupulosity tend to really struggle with that. So giving themselves permission or receiving permission, then limited information, that's where that teaching comes in, right? That's where, I'm hearing what's going on. We're asking questions, open-ended questions that are going to lead and guide and help me to understand what's going on. Also help to bring some clarity to them. But then as we're going through that, it's like, okay, I have a good conceptualization of this case, and I need to give them information that is specific to this. I'm not giving them a whole course in human anatomy and physiology, but I do need to teach them what is relevant to them. Okay? So that might be basic anatomy. It might be how the hormone cycles work. It very often includes an explanation of the sexual response cycle. Like you go from arousal to plateau to orgasm to resolution. All right. So there's going to be an education part that will be common to both therapy and coaching. Then you'll move to the specific suggestions. So that is where we bring in techniques and interventions that could be useful to them to resolve this issue. Okay. There, typically, you're going to see a little difference in how it's addressed, not necessarily, but usually. Therapy is going to be more about being, I don't want to oversimplify it, but I like to say that therapy is going to help you to be at peace where you're at right now, while coaching is more focused on how do we get where we want to go. So there may be more practical. Depending on what school of thought you're in, some therapists are going to stay very much in that diagnosing and treating realm, and less in the practical question. Some sex therapists give very little practical advice on how to have sex. Coaching almost always will give very practical advice on how to have sex in a way that will help to resolve the issue, right? Because that coaching is, again, very pragmatic, goal-oriented. How do we get you where you want to go? So that once we get to specific suggestions, that you can start to see a difference. There will be an overlap. For example, sensate focus is a common intervention that's used in both sex therapy and sex coaching. It's been around since the 1960s. So you'll see some overlap there. The last stage, however, is where coaching doesn't go. So coaching, that last stage is intensive therapy. And that's because some things don't need treatment to resolve. Okay? Many men who don't meet a clinical definition for ED, but they are having some sort of difficulty, it comes down to performance anxiety, and so we can work through that. Not so much of like how you might think of like processing through your grief or trauma, or like the cause of it, but just how do you stay in the present moment and let go of whatever stress that is to feel connected to your spouse where you're not worried about performing. Some things, however, do meet those clinical definitions, and there we do need to move to a treatment protocol. That's where the sex therapy can keep going, where sex coaching has to stop. You'll also see that if there is an underlying mental health condition that is preventing the coaching from being effective. So sometimes somebody is doing all the right stuff, they're doing the techniques that they're taught, but all these other stages are ineffective because maybe they have crippling OCD, or they have severe anxiety disorder, or borderline personality disorder, and they tend to split with their spouse. Right? So in the case that the cause of the sexual dysfunction is not, something that maybe is more pragmatic, sort of just the experience of life, the difficulties of life, once it gets to where it is of clinical significance, meaning causing distress and meets the diagnostic criteria, then we have to move into that realm. Most clients do not need that. The majority of clients will be able to get them to their goals in the first 3 phases. And that's why, as a coach, if I have a client who would need that, I can already see in advance that they might need that final stage. Typically, I'll already refer them at the beginning of coaching to a therapist who can start addressing those elements. And so we'll work in tandem while the therapist is treating, again, anxiety, depression, trauma is a very common cause of sexual dysfunction. I can be focused on the sexual and relational aspects. And that tends to work very well when we can work in tandem like that. I can focus on those practical elements, and then they can focus on that treatment element. Another variation that you might see between the two is, again, depending on the school, is coaching can get very focused on technique where therapy would not. Like I mentioned, that you might see a little bit more, but sometimes it will be extensively about technique. Some sex coaches, that is really the thing they're known for, is teaching all sorts of techniques, but like they may have like a whole plethora of different positions they know, or whatever different type of technique you want to imagine, they know all of them. Sex therapists typically are not going to be so focused on those things because it's not relevant to treating. You're not going to treat somebody's sexual dysfunction with another position. So that's another thing that can kind of stand out to people, and why many coaches will not become therapists, because they are very good at all that practical stuff, and that's where they want to stay. And again, most people can meet their goals without going to that intensive therapy range. So there's many sex coaches who stay in that range their entire career. Some, like myself, like to do both. But another issue with therapy versus coaching is I'm limited by jurisdiction and licensure. So I have the providence of finding a Catholic agency based out of Washington State, where my supervisor is licensed in 3 states, so I'll be able to see clients in 3 states. If it wasn't for that, I would not be able to see clients in any states because I'm not currently independently licensed. As a coach, however, I can see people all over the world. I currently have a couple in Ireland. I've had couples in Spain and Costa Rica, Australia. Had one couple that tried to start, didn't really work out because of time zone, but Korea. I've had some Canadians, a couple in Mexico. Talked to a few couples in South America, but weren't able to, like in Brazil, but not able to follow up with them. Just time zone differences, or not time zone difference, just negotiating life schedules and all that. So coaching gives me freedom to work on those things in areas where I wouldn't otherwise be able to do so. And since, again, only a small piece of that would need therapy, for very few clients absolutely need that, those clients I can much more easily refer to a therapist in their local area who can treat that disorder, while I'm able to reach a much broader audience for the apostolate with the coaching domain.
No, that's awesome, and that's a good explanation, kind of the difference. So if I'm a couple or an individual who maybe I'm the member of the couple who wants to take action first. I know, in this scenario, I'm a married person, or I'm a married couple, and I know we need help. We need help with this section of our lives. Do we see a therapist? Do we see a coach? How do we discern that? How do couples discern whether to go to therapy, whether to go to coaching, whether to do both? Since we're Catholics, I think we should also address, or do we just pray and spiritualize the whole thing, right? Any number of these could be in the mind of anyone who's listening, and probably it was in the mind of everybody you've helped. Yeah. So I think that's a big question that people need help with, whether it's about sexual matters or not. So if you speak to that, please.
Yeah, so that also brings in the question of confession and spiritual direction. Okay, and I've had so many people ask, well, I went and talked to my priest about this. Like, yes, great. Your priest was trained in moral theology for someone who is going to hear confession. Most likely, they have no sexual experience personally, and they have no formal training in anything aside from how to identify what is sinful. That is the extent of most priest training in sexual ethics, if they got even that. Unfortunately, many seminaries have switched from the de sexto model, so the on the sixth commandment model that was used by the manualist, to trying to build or use a read through of theology of the body as their entire sexual ethics course. It's great to read through the whole, all the different audiences. I've done it myself.
We like theology of the body at the Apostolate. We do.
Right.
But
there's much more, spiritual theology and Christian anthropology throughout the audiences than there is of sexual ethics, right? He does address abortion and contraception and homosexuality, right? These elements, they are moral elements. But the point of the conference, of the audiences, was not to teach moral theology as such. So when seminaries try to
or even how to have good sex in marriage, more particularly.
Right, there's none of that. Right, now if you look at some of the other writings of different popes, particularly John Paul II, like in Love and Responsibility, he does mention some of these topics.
Yes.
A little bit with a bit more precision. But again, that wasn't his focus in this. It was more about that overall relationship and how that relationship reflects God and etc. So if a priest went through that, the theology of the body only without supplement, so to speak, they probably have little to no idea of sexual sins beyond abortion, contraception, adultery, fornication, right? The big kind of obvious ones.
Pornography,
Pornography, masturbation, right?
All that stuff,
You get into, mutual masturbation between spouses, may not even know. I've actually met priests who had no idea if that was sinful or not, because it was between the spouses. So, why not? Right? Again, if they weren't taught with that precision, then they're not going to know unless they went out and found it on their own. And priests are like anybody else. Oftentimes we don't know what we don't know.
Right.
I had the grace to be trained in that more traditional model, the de sexto model, where we did dig into the parts of chastity and the different types of sins beyond just the kind of the big catechism level ones. So if a priest got that version, then they're going to be able to identify pretty clearly, okay, that's a sin, that's a sin. That's a sin, but it's a venial sin, right? Or that maybe is a fault, but not a sin, do better next time. Or that's not even a fault, that's human, that's normal, right? But when you read those manuals, a lot of people see them as very negative. It's like, well, yes, because this is meant for the confessional. The confessional is not a point to talk about all your virtues. It's to go in and accuse yourself of your sins, right? So the training for the priest is to interpret how bad is it, with the kind of supposition that what you are saying is bad.
Or at least whatever the person's saying, they must have some guilt or uncertainty about, right? Because these were manuals for confessors, not necessarily, here's what I'm going to go out and teach to the public. Granted, this might have been what the moral theology professor was going to teach to the seminarians to prepare them for their priesthood. But, I'm guessing the supposition here is that, this penitent kind of at least has some misgiving about what they did. That's why they're talking to me about it. So what am I supposed to say back? Well, okay, you're right. Mortally sinful, or venially sinful, or actually you don't have to worry about that one. So at least to help set the penitent, his or her conscience straight, because that's part of confession too. But that's still, it's not therapy, it's not coaching. And that's why we at the Apostolate, we focus a lot on the manualist tradition and the manuals, because because all of this is part of what we're trying to help form people in. And it's actually a misconception that we've talked about before, that all this stuff about, like, oh, what are you allowed to do and what are the limits of the guides of foreplay. Some people think that comes from theology of the body, but it doesn't at all. A quick read through the manuals shows pretty quickly these discussions were being had long before John Paul II and theology of the body. With all due respect to him.
Yeah, he was developing theology, but he did a lot more development of the concept of Christian anthropology and personalism than he did developing moral theology.
I think people get that perception simply because Christopher West is, although talking about theology of the body, has been willing to talk about these things too, and a lot of people conflate theology of the body with Christopher West. Fair enough. He's one of the more, if not most popular presenters of it in the United States. But it's simply the case that these discussions, or the rules, the principles, did not come from theology of the body. They predated by possibly centuries.
Not most of the time, by many centuries.
Right.
So that's the role of the confessor, right? To recognize and judge sins, to sit on the tribunal of mercy. Role of the spiritual director is while that's the negative, if you will, the spiritual director is in the positive. How does this pertain to your growth in virtue? Okay, so if you bring up your sex life to your confessor, which many people are not comfortable doing, but if you do, right, their focus is it virtuous? And how is this growing toward virtue? Or how is it hindering your growth in virtue? Okay? Whether or not you have vaginismus does not directly have an effect on, how you grow in virtue. You can have vaginismus and not be able to have sex at all, because you have significant trauma, and yet you're growing in virtue because you're carrying that cross well. Now, that could also be severely damaging to your marital intimacy, but again, that's not their focus, right? Each person needs to stay in their appropriate lane. The confessor is not, that's why traditionally confessors are not doing spiritual direction. They hear your sins, give you your penance, give you absolution, next. Right? If you want to go and deep dive into things, that's when you go to spiritual direction. If you want that treatment, you got to go to the therapist. If you want the more practical, go to a coach. Now, to your question of how do you figure out who to go to, okay? If it's a sin, or you think it's a sin, go to confession, right? I have clients all the time tell me, oh, I did this and I think it was sinful. I'm like, okay, I don't care. And they're like, what do you mean you don't care? You're a Catholic sex guy. I'm like, can I give you absolution? No. Not that I don't care about you or that how this affects you. I don't care because it is not my role. It is not my place to judge you in that judgment seat of mercy. To think anything less of you, to care about that as a bad thing. My role is to see, why did you do this? How did this affect your intimacy? What do we need to do to change it? In that perspective of that practical, how is this affecting your growth toward your goal? So if it's sin, go tell a priest. If you're wondering how your sex life affects your spiritual life, like as growth in virtue, people will talk about, should I abstain from sex during Lent, or should I give sex up for Lent? That's a question for your spiritual director. Okay?
And your spouse, that you got to agree on that.
Spouse, right? If you're going to give it up, right, it needs to be by mutual consent, because you have a right to their body, they have a right to your body, and your personal piety does not override your vows, right? Without their consent, right? There have been cases of, even in the history of the church, where a spouse gave permission for their spouse to go into a monastery that was, of course, extraordinary cases, but it has happened because the spouse gave permission for that to happen. So in that case, yeah, talk to your spiritual director. My job is not to tell you what to do. A spiritual director, their job is, right? They have the authority, that grace of office to tell you things. As a coach, I do not tell clients like do this or do that. I'll give it like, here's some homework I would like for you to do, but if they don't, I tell them you can't fail my homework. I have no problem failing people. I was a middle school English teacher. I have no problem giving Fs. This you can't fail, because if you don't do it, that simply tells me that was not the right homework for you at this time. So how do I need to adjust my approach, our interventions, to meet you where you're at, to help you keep growing, right? That's my job, is to know what tools to give you at the right time, okay? When it comes to the therapy and coaching, also throw in medical doctors, right? A lot of people, especially women, when they have a sexual concern, they go tell a doctor. Medical doctors, most of them have little to no training in sex beyond how it works and how it makes a baby, right? Even your average OBGYN, sure, they're going to be familiar with vaginismus, but considering how many OBGYNs cause vaginismus through medical trauma, they're not exactly the person to go to. Yes, medical trauma is incredibly common. I see it in probably 1 out of every 5 female clients.
Wow, that might be an episode in itself.
It could certainly be, a pap smear, cervical exam, a involuntary episiotomy during a difficult birth. Sadly, there's a lot of doctors who don't really care that much about their patients and don't seek consent. And they just do things. And that can feel very violating to women, understandably so. They are being violated. And very often their bodies, even if they're like, oh, the doctor's trying to take care of me, their body doesn't know the difference. And so their body responds as it would to rape. Vaginism is actually a sort of the body's built-in anti-rape system. I have some clients that'll be light enough where penetration is difficult or painful, but I've had several clients where their vaginism was so strong penetration was impossible. Right? So if you have a UTI or something like that, sure, go talk to your OB. I can't do anything for you over the internet. It's okay, cool. If it comes to how to do stuff and the mental health element, if you know that the cause is a mental health condition, right, because you have crippling anxiety, okay, you would do well to start with a therapist, okay. If you're not sure, you can feel free. If somebody is struggling with a sexual difficulty, Catholic, not Catholic, I do not care. I will work with anybody, anywhere, right? If you have a question and don't know who to go to when it comes to that realm, right, discerning between coach and therapist, just come ask. We can help you figure out who you need to go to. Very often, again, because there's that overlap for the first few phases, a coach can take care of it. Now, also a thing to note is that for many, many couples, sexual issues are actually just the sort of obvious part of relational distress. Right? If you don't like your spouse outside the bedroom, why do you think you're going to get along in the bedroom? Right? If you can't talk to each other about anything, what makes you think things are going to go great when you go to talk about sex or go try to initiate something? So really any therapist that works with couples, any marriage family therapist, effectively they're going to be doing sex therapy insofar as they're helping to repair the relationship, and it usually will have some positive effects in the bedroom, if assuming that there is an underlying point. Now, there are couples where they have a great marriage, things are going great on that department, but things don't work in the bedroom. That, again, could be trauma, it could be practical things. That's where whoever is easiest for you to get to, go to them, get started, because it's better for you to get started with the wrong one, with a coach or a therapist, than to do nothing, right? Because we can help direct you as need be afterwards.
That's a good point. I mean, as much as we are offering these principles for discernment, there's not really a wrong place to go, right? You start in one way, and then that professional will help you figure out, like, oh, well, you know what? Maybe you need, like you just mentioned earlier, right? You'll refer to therapy when coaching comes to a particular point, and that can mean that the therapy takes place alongside the coaching, or maybe there's a break from the coaching to go to the therapy. I mean, there's not really a right or wrong way. The more important thing is that you do something, and again, if you're listening to this, just come and ask us, and we can tell you, we can start working with you, and then, you know, again, if we realize, like, oh, maybe you need to talk to a priest, maybe you need to talk to a moral theologian, because we have one of those. Maybe you need to talk to, or you need to go to confession, or you need to talk to a doctor. But any good professional, any good priest, any good, even wherever they might not have had formation in certain ways, they'll be able to guide you to the right place. But I think at the end of the day, the most important thing really is to take action if something is wrong, or at least just not where you both want it to be.
And another thing to keep in mind for people too is that don't be afraid to use everybody, right? Some of my most successful clients had not just one or two providers helping them, they had a whole care team. Now, sadly, many providers do not want to coordinate and collaborate. I love to collaborate, right? I also have fewer legal restrictions, so getting like release of information is much easier for me. Some providers really don't want to go with the hassle of that, which is understandable. But even if we're not directly working together, working in tandem, in parallel, oftentimes has the best results. Like I've had a client who she had a regular confessor, a regular spiritual director, a talk therapist, a traditional like trauma therapist, a psychiatrist, an OBGYN, and me. So a whole team, which is fantastic, right?
Yeah, that is.
Lots of things to work through, lots of difficulties. It was a bit of a complicated case. Multiple layers, because there was mental health or several mental health conditions that were at significant play. So there was a question of medication, but the medication was having counter effects to libido, right? All these, different things, like, a male therapist didn't want to talk with the therapist about those things. Me, I'm still male, but whatever, that probably just because there's only me. Kind of had to get comfy with that. That case, it took a long time. It did take a long time. It was a complex case, but it has gotten significantly better, and I think that person is doing much better, and it's been a couple years now. But, sometimes that's what you need. And you know what? That couple spent a lot of time with providers over the course of a year, but they resolved something that had been a burden on their marriage for the last 6 years. Right? Do you really want to carry it for the next 20 years or 30 or 40 years?
Yeah, wow, absolutely, and I'm sure that's one of many cases that all of this was able to help. And I mean, at the end of the day, whatever route you choose or wherever you go first, I mean, I think the most important thing is you're worth being well. And if you choose to get married, or if you are married, you're worth being able to enjoy it. You're worth loving your spouse. You're worth having good intimacy, good conversations, good enjoyment of the marital act, a good experience of your faith, and not seeing tension between any of those lines, but seeing every element of your life as something that connects you with God and makes you holy. Well, very good. Well, any closing thoughts on this topic for this episode today?
Nope, I don't think so. Thank you for hosting.
All right, well, it's good. So, again, it's going to be a great service to the apostolate and to the people you see that you're going to be able to provide kind of both of these services, as well as it's going to be good for your own knowledge just to know how to pull from them both, especially when we at the apostolate start just, are able to kind of continue just educating more broadly too. So, yeah, thanks for pursuing all of that and making it available. Fantastic. And again, and I'll just close with that. For everyone listening, you're worth being well, and our apostolate exists to help you be well, particularly in your marriage, and then particularly in your Catholic marriage, in your faith, so that your marriage becomes a source of joy, but also a source of holiness, so that you and your spouse can spend eternity with God and with each other in heaven. So thank you for listening to this episode of the Catholic Marital Intimacy Podcast. Please do us a favor. Please like this episode, share it, comment. Let us know what you have to say in the comments. Please subscribe to our channel, and wherever you might be listening to this, please subscribe, tell your friends. And also, our apostolate runs on donations, so please, if you can support us financially, it'll help us with this mission to help marriages, because the cause of marriage is so much, and that'll be an episode in itself, but the cause of marriage, that is the cause of life, that is the cause of human dignity and well-being. There's just so many implications it has for the church as well as the entire human race, because that's really the thing about what we do. It might be hard to talk about sometimes, but the human race depends on it. So thank you for listening to the Catholic Marital Intimacy Podcast with James Walther. I'm Theo McManigal. God bless you.